Operation demonstration of SARS-CoV-2 antigen detection kit. Colloidal gold method applicable to nasal swabs. 1. The SARS-CoV-2 antigen detection kit, colloidal gold method, is suitable for testing nasal swabs. 2. The kit consists of an antigen extraction tube, including antigen extraction buffer R1, a test cassette, a nasal swab, a biosafety bag, instructions for use, and a certificate of conformity. Precaution: if the sealed package of the kit is damaged, do not use it, and please replace it with a new kit. 2. Preparations before the test. 1. Wash or disinfect hands and wipe dry thoroughly. 2. Please read the instructions for use carefully. 3. Blow the nose with toilet paper before collecting samples. 3. Testing procedures. 1. Take out the antigen extraction tube. Tear off the aluminum foil sealing film and insert the antigen extraction tube into the well of the cassette. 2. Unpack the end of the swab rod and take out the swab from the bag. Precaution: do not touch the swab tip. 3. Insert the swab slowly into the nostril about 1 to 1.5 centimeters and then rotate it against the inner wall of the nasal cavity for 5 times. Stay for not less than 15 seconds. 4. Take out the swab and insert it into the other nostril. Then repeat the same operation. Precaution: do not insert too deep into the nostrils, as this may result in risks such as nasal bleeding or swab breakage. When testing for persons aged 4 to 18 years, adults shall take samples. Do not use on children under 4 years old. False negative results may occur if the sample is not collected properly. 5. Immediately place the sampled swab into the R1 extraction buffer of the antigen extraction tube. Rotate around the tube clockwise or counterclockwise about 10 times against the inner wall of the extraction tube. Pinch the tube wall and squeeze the swab tip while taking out the swab, so that the liquid remains in the tube as much as possible. 6. Close the extraction tube cap. Insert the extraction tube into the well of the cassette and through the swab into the biosafety bag. 7. Open the aluminum foil pouch. Take out the test cassette and place it on the bench. Precaution: the bench should be in the horizontal and stable state and must not tilt or shake. If the foil pouch is open for an hour or more, the test result will be invalid. 8. Add 2 drops of sample solution into the sample well of the test cassette and start the timer for 15 minutes. Precaution: the presence of air bubbles in the extraction tube may result in an incorrect sample volume, resulting in inaccurate test results. If there are air bubbles in the extraction tube, shake the extraction tube gently to squeeze out some of the liquid to remove air bubbles. 9. Wait 15 minutes to interpret the results. 4.
Interpretation: the result. Positive result: if both the quality control line C and the detection line appear, SARS-CoV-2 antigen has not been detected and the result is positive for antigen. Negative result: if there is only a quality control line C, the detection line is colorless, indicating that SARS-CoV-2 antigen has not been detected and the result is negative. Invalid result: if the quality control line C is not observed, it will be invalid regardless of whether there is detection line, as shown in the figure below, and the test shall be conducted again.
5. Waste disposal. Upon completion of testing, all test components are placed in a biohazard waste bag and disposed of in accordance with local biohazard waste disposal policies or regulations.